Hi, good evening, everybody, and welcome to the second webinar of the webinar series Not All Talk by Praan Foundation. And today we're going to be commemorating World AIDS Day, and we're going to be speaking about mental health and AIDS and HIV. So please stay tuned with us because we're going to be having a guest speaker who is going to join with us, and she's going to share with us her experience of working with people with HIV, AIDS, and also a lot more about not only the people, but the people who are along with these people, their family members, and their caregivers especially. So that's what we're going to do today. So just hang on, and we will be inviting our guests in a little time, and we should then start off. Hi, Priyanka.
Hi, Aliza.
How are
I'm fine.
Yeah. All right. First of all, thank you so much for joining with us here today to speak about HIV, AIDS, its effect on mental health, and in general. So, before we get on to speaking with you, I just want to give like a general introduction, and I want you to stay along with us and, add on to wherever you think you want to say something on the entire topic. So, once again, thank you everybody for joining us, and welcome to our second webinar of the webinar series, Not All Talk. Today we're going to be speaking about World AIDS Day. And World AIDS Day is commemorated on December 1st every year. And it's an opportunity to raise awareness about HIV AIDS and actually to show international solidarity towards this particular, this particular disease that a lot of people are facing. Before we start off, I would like to say something to the World Health Foundation, and I'm going to quote them. So, the World Health Foundation says that this day is an opportunity for public and private partners to spread awareness about the status of the pandemic and to encourage progress in HIV and AIDS prevention, treatment, and care all around the world. It has become, an widely recognized health day and is a key opportunity to raise awareness, to commemorate those who have died, and to celebrate the victories of, increased opportunities for treatment, care, and prevention of the disease. So we at Praan Foundation always believe in, working towards the greater cause and, commemorating any opportunity, that we can leverage to create awareness. And that's what we're doing here today. So we are going to be leveraging this opportunity to speak about the effect of HIV AIDS on mental health of those living with HIV AIDS, their caregivers, and their families. But before we start off, I wanted, Priyanka, if you could just throw a little light on HIV, AIDS, and, what is it? Like, what is this entire disease that, HIV and AIDS is all about?
So, as we all know, HIV is a immunodeficiency syndrome that a person suffers through, and it is transmitted to different ways, and it has a lot of effects on people who suffer with HIV. And right now, as we know that there's no cure for HIV, but there is a lot of treatment that is going on right now to help people with HIV to come out of it. And it's not completely possible that people will be free from HIV, but at least have to live a longer life.
Right.
And
The prevention.
everybody already knows what is the difference between HIV and AIDS. So for the people who do not know it, HIV is something where they only have the infection, and AIDS is the last stage in HIV, where
Right, right.
people have very serious problems and can also lead to death. So if a person is HIV positive, it does not mean that he will have a very shorter period of life or something of that sort. because now when we look at people, they are able to live as they are living as healthier life as we all live.
Right.
So
I think
that's one thing
thank
that.
you. Yeah. I mean, thank you so much, Priyanka, for giving us the basic, understanding of HIV/AIDS. Just to add on to what you've just said. So HIV stands for it stands for human immunodeficiency virus. And AIDS is basically the autoimmunodeficiency syndrome that is associated with HIV. तो सबसे पहले HIV में what happens is that there's a virus that affects our body, which basically kills the white blood cells of the body, right? And that's what it does. So white blood cells are very, very necessary for everybody who's joined us. Just a little bit of information. So these white blood cells are very necessary in our body to fight against infection. Now, with the way, I mean, just as Priyanka was saying, there is so much advancement in medicine and medication that now it is possible to treat the virus with the help of medicines. However, there can be a stage when you're affected with the virus that all the white blood cells in your body die. And that's when you are said to be affected with AIDS, which is the actual syndrome where you have little to no white blood cells in your body. So technically, the smallest of infection can actually lead to death. Now, what happens is because your body does not have the strength to fight against any disease, you are very prone to illnesses, even very, very prone to something like cancer. Now, what has happened is that one thing we need to know, okay, that HIV might not affect a person almost till 10 years. So I might be living with the virus, but I might not reach the AIDS stage where I'm actually, detrimental and, something might, affect me or, lead to death or something. And people who are living with HIV are called people living with HIV. So I think that's one part of it. Another part of it that we wanted to speak about today is the fact that people living with HIV are more prone to mental health disorders. Okay, so just to throw a little light before we actually delve into this topic, there was a study that was done by the National Institute of Mental Health at Maryland and Columbia University, New York, which validates that individuals with serious mental disorders are more prone to acquiring HIV. And people with HIV and AIDS are twice more likely to experience depression when compared to the general population. So this and many more studies have kind of showed that there does exist a comorbidity between HIV and people living with HIV and basically, mental health disorders. Now, this brings us to the topic that there is a dire need because क्या होता है is that when people are suffering with HIV and AIDS, we spend a lot of time, and correct me if I'm wrong, Priyanka, speaking about their physical health, right?
Hmm.
That their physical health gets affected, and the kind of diseases, and I think a lot of talk is also about the social stigma. But I don't think that that much importance is given to speaking about mental health when it comes to, HIV and AIDS. Now, this is where we
Yes.
are actually be using your expertise and we're going to understand how it is and what it works. And just before we now formally enter the session where I'm like, going to ask you some questions, I just want to introduce you to everybody who's joined us. So once again, everybody, we have with us Miss Priyanka Singh. And Ms. Priyanka Singh is a licensed clinical psychologist and is currently working at the Dhriti Wellness Clinic. She has had an opportunity of working as a volunteer with an NGO, Nirakshan, which helps the HIV patients to maintain their physical and mental health. In addition, Ms. Priyanka is also familiar with the life of caregivers of HIV/AIDS survivors and their challenges. Now, without further ado, let's actually delve into the questions and understanding this better. So, first of all, I would really like to personally thank you for being with us here today. And just to start off with, at a very basic note, what are the most common stressors that people who live with HIV/AIDS come across with when they come to see a counselor?
Okay. So, when we look at the common stressors, the first would be the social support that they get from people. For example, it all comes back to again stigma, that the families, sometimes even the families do not support the family member who has HIV. So there they lack a lot of social support. Then they also have issues financially, like when they go for treatment, they are charged double or triple the price when they charge for a healthy person. But then that is one another stressor for them, and then they have to keep taking the medications all over their life, and any medications would have their side effects that come along with the medication. So when they take the medications, there is a lot of difference in their physical appearance that they have. So they become very conscious about their physical appearance, that their body is changing, and they get a lot of you can see the change on their face. So they become very conscious about it, that their physical appearance is changing. And if I have to give an example from where I used to work, so there were many people who would come up with several issues. One of a lady who had come saying that her daughters are not supporting her, and they have left her out of the house when they came to know that she is affected with HIV. So there's a lot of discrimination that goes towards them. They are already suffering with an illness, that upon that they have to go through all the discrimination,
Right.
and they do not have any support system along with them. Like the lady had, she had two daughters, one of them who was married and the other didn't want to live with her because she was affected with HIV. So, and also another point, that she wasn't working and she
Okay.
was unemployed. So there were a lot of stressors, and this is not just one case that has all of these, but there are many people who have it. And sometimes when somebody comes to know that they're HIV positive, or in a place that they're working, they get to know about it. They might just ask them to leave the place, or they might not want them to continue working there. So the whole of their life they just have to hide their diagnosis from people. They should just make sure that nobody else comes to knows about it, nobody else knows their secret, so that they don't discriminate them, or they do not take them off from the job that they are working at, or the institution that they are studying at. So, and having that pressure on them, that what if people come to know, even that adds up to the stress that they already have with the illness.
Right.
So
Sure.
these are,
Yeah, go on. Sorry.
yeah, so these are some of the stressors that really affect most of them.
Yeah, I mean, it's very sad to see, okay, that medicine is doing, medicine has advanced so much, and there are a lot of people out there working day in and day out, not only working to see what can be done for the HIV virus, but also working with AIDS, which is like the acquired disease because of the virus. But it's very sad to see that the biggest form of stressor comes for these children, comes for these people because of just lack of support. I mean, there is such amount of stigma that is associated. So I believe that from what you're saying, and also some cases that I have seen, they have a lot more stressors on the social side, on a personal side, which of course affects their health, which has a very, very adverse effect on their health as well. So, this is definitely, one of the most important yet most saddest kind of stressors to see in a person who's already, relearning how to live their life after being affected. So that was very heart touching, especially that particular case that you told us. And we just hope and pray that, that lady is fine and, now she's doing better. Now, with this, I think. You have spoken about most of the social stressors that people face. What do you think are the common emotional distresses that people face, or mental distresses that are caused because of HIV? Like mental, I mean, cognitively or emotionally. What are the common distresses that these people tend to experience?
So, sorry. Like all of us who are not HIV positive, we are also prone to mental disorders. And when it comes to a person living with HIV, he has a double of risk of having any mental illness because they already have a lot of stress that they are going through, which affects them. And also emotionally, they need an emotional support which sometimes lacks with people, so that adds up to their illness. And also several researchers have seen that people with HIV have more double chances of having depression or anxiety disorders, or even for the matter of fact the cognitive disorders like dementia. um, so like even you had told that depression is twice more
Yes.
prone in people with HIV. So that's how it's a lot many things that affect their mental and emotional state, and which leads to um, again coming back to the mental health. So they there are a lot many things like that add up to their stress. They can be a lot of the social isolation from the people that they go through, then the financial conditions that I have already discussed, their appearance, or the worries about their families. Like if parents are affected with HIV, they worry about the child. What about the child? What will happen to his or her child's life? So there are a lot of stressors that they go through, and along with that, um, like we everyone have our own stresses. Like during this COVID period of time, everybody is under stress and everybody is going through some or the other mental illness. So they have a double of it because they are going through all of this. Along with it, they have a condition that they have to live with. So somewhere that adds up, and that affects their mental and emotional condition.
Right. So, from what I gather, you're telling, and just to add on a little bit, that इन लोगों को है ना सिर्फ एक ही तरीके से affect नहीं होता है. So these people are not
Yeah,
just affected
right.
in one way, especially because the virus itself, resides in them. It is an added stress, and they have to live with this for their life. In addition to that, the biggest problem comes from social stigma, or and because the
Yes.
virus is already weakening them up, they're just so much more prone not only to a physical illness, but to like an emotional distress or a mental distress, like cognitive problems, like you just said, that they are more prone to
Mm.
depression, dementia, and all these things. So it's the fact that these people are not just affected in one way, but they have stressors that they experience on an everyday basis,
Yes,
which have like a 360-degree turn to them, making them so much more affected
absolutely.
with the entire disease. Ah,
Because the
okay.
HIV is affecting their white blood cells, right? So obviously it would
Yeah.
affect their nervous system. So that's how it's linked to the cognitive disorders, and it leads to a lot of people. There are a lot of, we also have a category separately. When we look
Yeah.
at the ICD or the DSM, they do have a category called HIV in dementia,
Yes.
dementia
Yes.
and HIV.
In the
So
latest
that's
DSM,
how
I
it
think they
is.
had it totally.
Yeah.
All right. Now, there is one specific population of HIV which we would like to focus on for the next question. All right. So, in the US, nearly all HIV infections in children under the age of 13 are from a vertical transmission. So, this basically means that it is passed on to the child from the mother's womb, or they pass on through the birth canal, or through breastfeeding. The number is now reducing because now again, like we were discussing, that with the advancement of medications and medicines, it has become much more easier for the doctors to be able to diagnose this condition, and it's treatable at least to a certain extent. Now, most kids affected with HIV and AIDS receive the infection from their parents, so they technically have no control over it. So, could you please comment on the lives of these children who are living with HIV and AIDS, because they don't understand कि उनके साथ हो क्या रहा है, and it's very difficult for them to live like that. So, have you worked with them, or like what is the general comment that you would want to give for such children?
So the foundation that I work with, Nirikshana, they also look at the children who are, suffering with HIV, which has come through the vertical transmission that you spoke about through the parents. So they also look at their health, and they are also under constant medication and constant treatment. And when they are at a very younger age, they do not understand what HIV is and what are the effects of HIV on them. So, whenever we are trying to explain the child about the condition, I think we should make sure that, we explain it to him in a way at, when we go to his level, and then
Right.
explain him in an easier way to make it less scary for them to understand what the disorder is. They shouldn't feel that, oh my god, I might just die. So we need to make sure and explain them very calmly what it is and what can the effects of this disease be on them. And it is not as bad as people say, because when they are taking medications, their condition is in control and they are as healthy as we are. So we need to explain that to them. And I think that, when we include about explaining about HIV from a very younger age to children, we can also target the people, like the children, who are already affected with HIV, and also we can reduce the social stigma that is around in the world, because the younger children are the future of our world,
Yeah.
of our nation, and everywhere. So when they are aware of what it is, so we can expect that the discrimination and everything is a more lesser in future for them, at least when they
Right.
grow up.
Yeah, I totally, concur with what you're saying. I mean, it makes so much more sense that, but then again, we need to like emphasize on one point here that, when we're speaking about children living with HIV/AIDS, they need to understand that it's not their fault. Or actually, I don't even think this is for children. This is for everybody. That,
Yeah,
specifically children who have received it from vertical transmission. For us to break that, that barrier that they have within themselves, that something you like, a young child who's got an HIV might feel that because they haven't been good, they have been given this disease, or whatever. I think that is one stigma that needs to be broken by speaking to the child. And like you rightly said, you need to go down to their level. But what we really, really need to work on as an entire society is understanding the fact that discriminating against people with HIV, people living with HIV, or children with HIV is no good. I mean, there needs to be maybe more focus by the government on education, schools, the entire education system should probably work on this. Because once we break this stigma, and we need to understand that these children can safely go to school. But the problem is not the fact that they're physically fit to go to school. The problem is that we are not ready to accept these children into school. So I think
exactly.
that more than speaking with the children, which requires a lot of sensitivity, going down to their level, explaining to them, and making, giving, equipping them with a coping mechanism at a very young age. As a society, we need to basically change, because these children are the future of the country, and if taken care of well, they can definitely do as many wonders as you and I or anybody in this world can do. So I think
Absolutely.
breaking the social stigma is the biggest key for people living with HIV, children living with HIV, or anything of that sort. So thank you so much for reflecting on that, Priyanka. Now we want to take a shift again, and now I think we want to focus on another kind of population which is not directly affected by HIV, but does take the indirect brunt of it. Okay, so there is this entire population. There's this entire term which has now become very famous. It's called a caregiver, right? Now, a caregiver is a person who is usually a family member or a known person of a person suffering with a disease or a disorder. In this case, we're speaking about HIV. So, this is a person who's taking care of the person living with HIV. Now, being a caregiver for a terminally ill patient can definitely have its own effects on the person, right? Because their own life technically might come to a standstill when they're caring for somebody who requires your continuous attention. So, would you want to speak about caregivers for HIV patients, and how their life might be different from ours, and what we can do as a general population to, or people being in professional psychological care, to reach out to them, or to work with them, work towards their betterment. So what do you think we can do at the caregiver front?
So when we talk, so when we talk about the caregivers, these are the people who care for the people, and whether it be HIV, cancer, or any other terminal illness, there is already, we understand that there's a lot of stress that they go through and the anxiety that they go through for the person. And also there's a lot of grief that they go through for that person, because they are living with them for all of the time, because most of the time the caregiver spends with them. So it's a lot of grief that comes into them. And then also like there is a lot of discrimination towards the patients when people come to know about it. And if the caregiver is a family member, we cannot, there is also sometimes that the discrimination also happens towards them, like they are questioned that did you go through a test, are you positive or negative? So sometimes that is like it added to the people that if that person is positive, it does not mean the whole family would be affected with it, right? And there could be several other reasons. And already their family member is going through the social burden from all over everywhere, and the discrimination that is going towards them. So looking at your family member going through all of these things is obviously very distressing for the caregiver. And if a caregiver is a child and the parents are affected with it, and if the child grows up seeing all the discrimination towards the parents, so obviously the child goes through a lot of pressure, and it internally affects his mental health. And as the child grows up thinking that even I am one among them, and people will start discriminating me as well, and even I have to hide from people that my parents or my chacha or my uncle is HIV positive, because even people might not even want to meet me or want to talk to me. So, and because of this, it happens that they usually don't go out, they try to avoid social contact with people, where they reduce whatever the activities that they would like to do, because they are already having all that mental pressure on them. So that's how it is, and they have their own life pressures that they are already going through. And then on the top of it they have the jab हमारा family member is affected with something, obviously we feel very bad about it. And sometimes they might also have the thoughts that what if something happens to them, what if some illness happens to them, what will I do? So
Right.
that is a very stressful thing for a caregiver to go through, because they know what their condition is, they know how their immunity is, and they are more prone to several illnesses that are around in the world that we have. Like right now we have COVID around, and in this period they might be undergoing a lot more pressure, because if the caregiver is a earning member of the family or not, and if they have to go out to get something, or if they have to come back after work or something, they would not be worried about their health, but they might be worried about their family. That what if the illness affects them, the virus affects them, because that can be more dangerous for them, because we are immunity strong, but they are not very stronger to tackle the illnesses, and they might have a lot of the symptoms that people are having. So it adds up a lot. And currently in this situation, yes, there is a lot of pressure that the caregivers go through.
I know. I mean, I especially like the point where I think you just spoke about the fact of how, if a child is a caregiver, I mean, let alone an adult who has to, put their entire life to a standstill and, go ahead and take care of somebody. But, imagine, and, while you were speaking about it, it actually struck me really hard that, how would it be for especially a child to be the caregiver of maybe parents or a family member who's, suffering with HIV, or, is living, sorry, with HIV. And it really might be very, very difficult for them. I think just to add on, there is a lot that, ek to jaise you said, that, their own life is come to a standstill. There is social stigma. There is no time for leisure. You're either working, studying, and you're taking care, which itself, can be such a big, big, big problem. Like I remember when we were studying bachelor's, I think one of our classmates did a study on caregiver illnesses, and I remember, discussing this entire study in class, and how for the first time we had come to a realization that it's not only those who are affected, but there are so many more people who are in entire, in a parallel way being affected. So it's not only about living with HIV, it's also, living with HIV in a family where there are so many other people or there are other caregivers. I think I mean, just to add some more light on this particular question, this is something that would be like a quick suggestion that if there is somebody in your family who's suffering from an illness, or if there is a person living with HIV, a quick suggestion from our end would be try not to have only one caregiver for this person.
Yes.
What happens is when you have more than one caregiver or more than one person willing to take the responsibility of this person, I think the burden or the stress can kind of be divided. Okay, also, these people, because they live, and I have seen this in some particular cases, that when they are living with these people, they might start exhibiting some symptoms which might also be scary for these own people. But more than that, the loss of this person can have a very, 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 very big effect on this particular caregiver, because they have lived with them, they have seen them so closely, and they have literally like walked through the entire life of this person with the disease, in their happiness, in their sadness, in their suffering. So I think grief hits them the most. So it is really, really
Yeah.
beneficial for caregivers, because I think this is a particular population who we can reach out to. So as a suggestion, I would like to say that if there are people who've joined us and no caregivers, so reach out to them, support them, be with them, and within your family, if God forbid there is somebody who's suffering from a illness, and there is a person who's giving care to them, try to see if this burden, or this responsibility rather than burden, can be shared by more than one person, because that I believe should be like very, very beneficial. Now, like you said in the very beginning, okay, that people who are living with HIV, AIDS, and like WHO has said that there is a lot of spark for them, to live healthier lives. And this is not the end. Like it's not the end. It's not a death sentence anymore. Like pehle, because we do not have enough medication. Mostly, getting infected, or having the HIV would immediately lead to AIDS, and then it looked like a death sentence. But now it's not anymore, which is a very good news. So, what do you think? What are the some ways in which HIV/AIDS patients can try to bring positivity in their own lives? Like, what can they do to hold the reins of their own lives and just be more positive?
Okay. So, from my experience, the NGO that I was working with, they have a lot of counselors who work there, and actually the counselors who are working there, they are all HIV positive, and they counsel the patients who come there, and this they share their experiences, what their experiences were, and how did they manage to tackle their issues in their life. And they also have like a religious supporter who would sit there and who would also pray for them. And the main thing is that they can share their life story with people and inspire them to live with it, live with live with HIV and still be happy with it, because it's not as bad as people think. Because there are so many people who get infected with the illness, but then they do not completely know what it exactly is. So when people who already are positive and they share their experiences and they share, like, they can also have some misinformation or myths that they must have
Can
heard
be
from.
proven.
Yes, so that can be broken, and they can, teach them what can be done, and how they can live a very more happier life. Then also, if they need some support, reaching out to people and taking support from them, whether it be in any ways, emotional, mental, or any ways. Like this NGO, they have their own place that they make bags and they help the people who do not have a lot of financial support. So people who are positive with HIV and do not have a job, they help them find jobs, and they help them to find, and also they have doctors who work there to work on their physical health, to normal सर्दी जुकाम वगैरह का कुछ ऐसा होता है. Because when these people go out to the doctors, there is a lot of discrimination somewhere through them as well. Even when they are in a medical field, they do discriminate them and they do not provide all the services. So that is like a very big stressor for them. So to help them and motivate them to have a better physical health, and I think they should also try to inculcate and have nutritious food and sleep on time, and also exercise well, to have a more healthier life, and try to control on their habits. Like some of them who must be HIV positive might, to come out of it, try to get onto some substances like alcohol and smoking and all of these. So maybe they should try to, if they are already into those habits, try to quit those habits and have a more healthier life, so that it does not affect their immune system, and they're able to live a healthier life and exercise well, so that they can maintain their physical health.
Right. So, I think, first of all, I think what your organization, Rakshana, the place where you were an intern, is doing is really, really beautiful. So, kudos and a shout out to them for, wonderfully taking wholesome care of a person who is, living with HIV. In addition to that, I think what you have said is it's very important for them to take care of their physical health, to be more positive, and to make it a habit. Okay, so in life at times when you really want something to work out, I think consistency is the key. And if they consistently work towards making a more healthier lifestyle, then it's definitely beneficial for these people and for any and everybody who's living with them. So I think you've already answered parts of this, but I still want to ask you that does counseling play a key role, or does it play a role in helping people with HIV, the caregivers and the family? So there are three segments that we have discussed. That there is a family, there is a caregiver, and then there is a person living with HIV. So would you suggest these people to go to counseling, or like what would you say to people? Should they really like go in for counseling for something like this?
So obviously they do need counseling. Like even the family or the caregiver, they might not know everything, all the information about HIV. So a counselor can help them to gather all that information, to know what can they do for their the person, their family member who is affected with HIV, how to take care of them, and what all can they do to support that person. And you know um, and counseling can also play a role in reducing the discrimination and stigma that is around everywhere. For example, like I already told you that social support is a very big stressor for people. So in that social, in their environment, their caregivers, their family, they need to be educated first, so that they do not discriminate the person who they are living with, and at least they have an emotional and mental support from their family members and their caregivers. So that really helps. So counseling really helps in breaking the stigma and to make people aware of what are the effects and how does the infection actually spread, because there are many people who do not really know how the infection actually spreads. So through counseling we can help them get aware of these things, and we can also help them find out what are the issues that they are facing, whether it be a patient, whether it be the caregiver, all the family, and help them to strategize and plan what they can do to help themselves, help their family member, help themselves to come out of the issues, and provide them support through counseling, and how much ever support we can provide them, because obviously somewhere when the family is living with with the patient with HIV, they have their own mental stress that they go through. So counseling can be a way where they can let out all their emotions, let out all their stress that they have, with regards to the patient or with regards to their life. And even when we let out things out of our head and out of our, we feel a lot better.
Absolutely.
जब हम किसी
Yeah,
से share करते हैं हमारी बातें, we just want
yeah.
people to, so
Listen to.
yes, so this really helps all three of them to let out their mental tensions and focus on having a more better and healthier life for the
Makes sense.
patient as for the family members.
Yeah, I think that's absolutely right. Okay, so therapy in that way gives them an opportunity to vent out, to learn more, and to empower themselves to live a better life. So at Praan we have our vision statement which says that we believe in educating, we believe in creating awareness, educating and empowering people. And I think that just with this one particular response of yours, you've covered all the three statements that we believe in at Pran. And I think that's what a therapist does. A therapist can bring awareness. A therapist, can educate people and they can empower people. And specifically with a person who's living with physical stressors, social stressors, mental stressors, emotional stressors, and those, affected because of this person should seek counseling, not only to de-stress, but also to understand better and to create a support system for themselves, for the person and everything. Now I think that's one set of questions that we have answered. We have a lot of people with us on who've joined us here, and they're all the first responders at Pran. So I'm just going to take a minute and I'm going to introduce the first responder program. Now, at Praan Foundation, we have a wing that works with volunteer engagement activities. And one of the activities of the volunteer engagement program is the emotional first aid training. So we have individuals above the age of 18 who can come, they join into our program, and they're trained on emotional first aid. Now, my favorite term to describe these people is mental health warriors, because they reach out to personal spaces of people, identify that a person is undergoing emotional distress, and they support these people. So we believe that they're creating the ripple effect that we always speak about. So we train them, and then they go and they are representatives of Pran in the field, if I was to use the right words. So, if these people who are young and not professionally trained, but are willing to help out somebody with HIV, AIDS, what would you tell them? Like, is there a message that you would like to give them for the work they're doing? Or, if they are to meet a person with HIV, AIDS, how do you think they can support such a person, a caregiver, or a family?
So, first of all, the idea of first responders of providing emotional first aid is a very innovative one, and also it is the most needed thing right now, the phase that we are in. And spreading awareness and helping people come out of it these people can play a very strong role there, because you know they can guide people to go for a better treatment. They can provide them support, and they can also guide them कि कहाँ जाना है, किस कौन कहाँ जाएंगे तो बेटर होगा, because they are the first people who do analyze it. And when they are able to help them, they can, like I told you, that they can be the person who मतलब जो बात को सुने, just
Right.
hear what they are saying. So that is what would a person need, because they might have gone, in particular, if I have to speak about the people with HIV, when they go for their medications, they already are counseled about everything and all of it. And when they have a lot of mental illness that they already have, they don't take into consideration that they should actually go and see a therapist or see a psychologist to get them treated, or they will just put it कि हाँ मेरे को ये illness है, इसकी वजह से सब हो रहा है, तो अगर मैं इसके बारे में कम सोचूंगी या सोचूंगा तो शायद ठीक हो जाएगा. But that's not the case. You also need somebody to listen to what are the stressors in your life, and to hear out. They want people to hear out to them. So I think these people can play a very big role there in terms of people affected with HIV. And also because there is a lack of social support for most of them, and there's a lot of stigma and discrimination. So the first responders can play a very big role there in breaking the stigma in people, spreading awareness about HIV, and also being a support, an emotional support for the person who is who is affected with HIV. So I think that would be the best thing that they can do for them, and being empathetic towards them, and just lending an ear to listen whatever they have to, because they might not choose to go to a psychologist in the beginning. So these people are all
They can
around
be
you.
like pathways through, that can take them to therapy, right? I mean, that's I think that's a very that's very insightful, the way you actually make this look. I think that also like adds a lot of relevance to the first responders program in general. With this, I think we would come to an end of a very, very insightful discussion with you, Priyanka. Thank you so, so, so much for agreeing to join with us and, speaking with us about this. And I mean, I don't have enough words to express how grateful we are to, have you with us here today. And you've explained everything at such a easy pace that, I'm sure that people who've joined us have definitely benefited from the entire conversation. So once again, thank you for being with us. And I would also like to take this opportunity to thank everybody who has joined us in this entire, series of Not All Talk on this, AIDS special. Thank you so much, Priyanka, and I will see you soon. Thank you,
Thank you.
everybody. Bye. This is us logging off.
Bye.
I'm
It's a
sorry.
pleasure to Praan Foundation, and also um, that the first responders will be doing that. That is a very great job, and I would like to congratulate you people for encouraging people to come out and provide emotional first aid, especially for the people with HIV, because I have worked with them, and I have like a very special thing for people, when, because I have seen people around me when I was counseling them, so they're very close to me. So I think when people um, come up and break the stigma around HIV, I think it will make they will have a more better life
Right.
like us. So I think your efforts should pay off, and people with HIV should have a more better life in future. And I think the first responders help them, and break the stigma around it and be a support for them. That is
Thank you
what
so
I.
much. Thank you. Thank you so much, Priyanka, for this closing statement and, for such a good way and a good explanation. Thank you. Thank you so much for joining us. And bye, everybody. See you around.
You're welcome. Thank you. Bye.